Okay. Welcome everyone to the Department of Volunteer Services at Mount Sinai onboarding Zoom info session for the Delirium program. My name is Ruth Mendivelso, onboarding specialist with the department, and my role is to support and guide you throughout your onboarding process. You have received the onboarding materials, I believe, a week now. So some of you have started, logged in, started working on it, or some of you yet to start. So this presentation will be about covering everything you need to know, such as the Visas Live portal account, how to navigate it, the health clearance process, and we're going to hear from Nurse Ashley. We're going to go over the background screening, managing references, educational modules. We, um, I do have information about your deadline. And then last but not least, we'll have 5 minutes for any Q&A portion. And you can also take this time to ask Ashley any questions you have during the Q&A. Somebody came in. Okay. Like I mentioned, everyone should have access to their Visas Live portal account. The web address is mountsinai.visaslive.com. This is where all your onboarding materials exist, where you're going to complete and upload. So I'm going to do a live demonstration. You're going to click on existing user login. The user ID and password is the same credential you use to submit your application. So for the user ID, it is a full email address and then the password you created. If you have any issues logging into your Visas Portal account, please send us an email at volunteer@mountsinai.org. Once you're logged in, you'll see a few menu tabs and in your homepage, two checklists. The first checklist is titled New On-Site Hybrid Volunteers. This is your main and only checklist that you need to focus on. If you scroll down, you do have a second checklist titled Initial Health Clearance. The initial health clearance checklist is just for your reference only. You don't need to do anything within this checklist. It just breaks down the health requirements and there is links for additional tips. So for example, if you want to know more about the physical exam, you can click on the link. It'll be a PDF document on tips and it will say here that this is not the EHS form. This is not the official health, Mount Sinai health forms. So do not print and bring this to your doctor to complete. If you upload this completed by your doctor, it will be rejected. Employee Health Services will not review. So once again, it's just for your reference only. So before we go over your main onboarding checklist, let me go over some navigation on your Visas Portal account. So within the menu tabs, you have home. When you click home, it brings you back to the checklist. The message menu tab is to request toxicology if you have not received your Q passport email from us within 2 business days. This is where you would click on this. The upload health clearance documents menu tab is the same page when you click on it as clicking on the health clearance requirement. It will bring you to the same page to upload your health form. Manage my references, we will go over shortly, but this is where you will add, cancel, or resend your references. And my uploaded documents is one of my favorite menu tabs, and this is where you will see all the documents you have uploaded and their statuses. So for example, this example here, it lists all the documents that was uploaded by the volunteer. So the bigger the description and the type text is, the last column, which is the status, will hide. So if you want to know what's the status of the document you uploaded, my suggestion is to type it out in search. So for example, typing out the medical document's name, the last column status will appear. It'll let you know what's the status. Now, what does each status mean? For non-medical documents, you could view if the status is pending, approved, rejected, or is a duplicate. For medical documents that you upload, you can only view if the status is pending or transferred. So going over medical documents first, pending means it wasn't transferred yet. Transferred means it was transferred to Employee Health Services for their review. For the non-medical documents, pending means is pending review by our office. It'll take about 2 to 3 business days. When it's approved, we reviewed and approved it. If it's rejected, we will reject it and you will receive an email why it was rejected. If it's marked duplicate, it's because we reviewed all the documents of the same upload and marked the second or third as duplicate. As well, in your checklist, you will notice highlights once you start uploading stuff. If it's highlighted in gray, it's pending. If it's highlighted in yellow, it means it's rejected. So I'm going to go back home. There's also a percentage bar in your main checklist. Right here, it lets you know how far you have completed the onboarding process, and this is based on approved requirements. Okay, so we're going to start off with the first requirement, which is the health clearance. So for health clearance, you're going to click here for instructions, and we're going to go over each step, what applies to you. So the first one is to download the health forms. So you're going to click on the link in number 1. And the first 3 pages is detailed information of the breakdown of the health requirements. So please read that carefully. And to download and print the official Mount Sinai health forms is on page 4 and 5. The last page you could disregard, that is just for minors. So you're going to download and print page 4 and 5 titled EHS Volunteer Clearance Form. You're going to print your name, date of birth, phone number, email. You're going to write that information down. For department, you're going to write Delirium. And for facility, meaning which Mount Sinai location, which hospital, you're going to check off Mount Sinai Hospital. The clearance requirements 1 through 8, that is to be completed by your doctor or whichever doctor you visit. And it needs to be returned to you completed, signed, and stamped. Before we go over how to upload it, this is where I will pass it on to Nurse Ashley so that she could provide more tips and information.
Thank you, Ruth. And thank you to everyone joining and offering your time to volunteer with us. As Ruth said, I'm Ashley. I'm one of the nurses with Employee Health, and our department is responsible to medically clear all the volunteers at Sinai. I wanted to point out some things for the health clearance process that will help expedite things for everyone. These are all questions that volunteers have asked over the past few years. So I've compiled this and I'm hoping it will be helpful for you. If you're a person who likes to take notes, I would get out a pen and paper now or note it on your phone. But I wanted to start with one of the tip pages here to highlight some of the drug testing points. Now, for the drug testing, urine drug testing is done with Quest Diagnostics. The drug test is no cost to you and it can be done in any US state. We have a lot of volunteers that live in New Jersey, for example, and they ask us, can I do the test in New Jersey? Yes. As it reads, the volunteer department will email you what we call the Q passport, which is a barcode order form to take with you to a Quest location. These orders are time sensitive. The expiration date of the order is at the top left of the order form. Please disregard the line that says the drug testing is done with your primary care provider. That's not accurate. You will see that it lists what substances are tested. And it notes that legalized recreational drugs for New York State are not tested. Now, if anyone is on any medications that could trigger the drug test, such as an ADHD medication, for example, Quest has its own protocols that it follows. Depending on what medication you take and the dosage you use, it may or may not trigger anything. If it does trigger something, Quest will call you directly and ask you their questions. They will ask you further information and they will ask you to submit your active prescription proof to them. I always recommend you keep an eye on your phone about a week after doing your drug test. because they will usually call from a 1-800-1888 number. It will look like spam, most likely. So I just want to point that out. Um, and also, I want to remind everyone, it's not something, the drug test is only valid for 3 months during the onboarding process. So, for example, I had a volunteer that did a drug test in February and then started submitting onboarding materials in November. That February drug test that was done is no longer valid and had to be repeated. So keep this in mind in terms of time frame when you're submitting everything. The line that reads your urine toxicology test must be completed before your physical exam. I get a lot of questions regarding this line. Your drug test and whomever is filling out your health form, they are unrelated. Your doctor, whomever is filling out your health form, does not need to review a test, sign off on your drug test at all. The drug test results get sent directly to our department and we review and sign off of it. You'll notice on the health form that we go over that there's no drug testing point for them to sign off on. So they don't need the results. They don't need anything to do with your drug testing. This line is just in terms of timing. It's encouraging you to, for example, when you upload your health form into your Visas portal account, ideally your drug test will have already been done so that when myself, another nurse in my department, and one of our doctors, when we review your health form, when we go to pull your drug test results through to sign off on that, it is already there ready and waiting for us. So that's all that line is really referring to is, again, timelines. And lastly, you'll notice the last point. If you refuse to test, if Quest marks a refusal, you will not be granted clearance to volunteer. So now let's take a look at the actual health form. It's 2 pages. I know whoever is completing your health form, it is their job to read what is required. However, I know they're busy and things can get missed. So I simply want to give you guys as much info as possible. The health form itself cannot be bypassed. If you are doing any blood work, for any blood work done, you want to attach the lab reports for those blood work that you're doing to this health form. Point number 1, physical exam, just a date needs to be written in, nothing further, has to be within the last year. Number 2, I want to take a look at, it's the tuberculosis section. There's a lot of wording here and it can become confusing, I know. So I want to just simplify it for you guys. You have 2 options for the TB testing. You can do either 2 TST skin tests, or you may also hear them be called PPD skin tests. You'll see the line there, TST number 1, TST number 2. Or you can do the quantiferin gold blood test. Now you or your provider, whomever's signing off your form, you can decide which is best for you. Most prefer to do the blood test if they have that option available because it is less time consuming. I want to point out and highlight the time frame requirements to pay attention to in the right and parentheses there. If those time frame requirements are not met, those tests will not be accepted. So if you're going to pay attention to anything out of all this verbiage, just really pay attention to the time frame there on the right. You will also notice there's a chest x-ray line there. That is for a certain circumstance, and that circumstance being if you have ever had a abnormal or positive results for the skin test or the quantiferin gold blood test in your lifetime that you're aware of, then you would want to do the chest x-ray option. The x-ray has to be done within the last year, and the radiology report has to be attached as it notes there. You would also want to attach your past abnormal TB test results too, so that when we review your file, we understand why you're submitting the chest x-ray. It's due to your past abnormal results. Moving on to number 3 and number 4, MMR and varicella. They both have the same requirements. It is 2 vaccines in your lifetime. Dates do not matter. Childhood doses are accepted, recent doses, it doesn't matter the dates. Or if you don't have 2 vaccines, you can do a titer, which is an antibody blood test. You don't need both. One or the other is sufficient for our clearance purposes. Number 5, the hepatitis B. You have 3 options as it reads there, yeah? You can submit a completed vaccination series 1, 2, 3. You can submit again, a titer, an antibody blood test that shows you have immunity, or you can sign a declination. And Ruth can give you our email. If you would like to decline, I can send you our declination form. We always encourage all volunteers to pursue hepatitis B immunity. However, it is optional. Hepatitis B is spread blood and bodily fluids. So keep in mind the setting where you guys are in. A volunteer who is doing administrative tasks in an office setting is, of course, going to be less at risk than someone who's in the emergency room, which is a high risk setting. So keep in mind before you sign a declination on that. I just want to point that out. Flu shots required for the current season. There are no exemptions for on-site hybrid volunteers. The flu shot is needed. And then number 8, the tetanus, thank you, for the tetanus is pretty self-explained. You want a Tdap vaccine in the last 10 years. And number 8, a lot of people miss this yes or no question. We get perfect forms, and this question is not answered, and the form gets rejected. If you have a chance to review your form before uploading it into your Visas account, please make sure this question is answered. And then once all is said and done, at the bottom, the form has to be signed and stamped. It does not have to be a PCP office specifically. Past volunteers have gone to CityMD, MedRite, CVS Minute Clinic, community health centers. I had one volunteer who was very close with her rheumatologist, and he was comfortable signing off on this form. If you have a specialty doctor, any nurse practitioner, physician assistant, MD doctor can sign the form. Hopefully that helps a bit. I know it was a lot, but I know Ruth will open up, like she said, the Q&A at the end, which I will stay on for if anyone has specific questions. But I will turn it back to Ruth now. Thanks all.
Thanks, Ashley, for all that information. So I hope everyone took notes. Even though this session is recorded, it's helpful to have the information now in case you're going to see your doctor sometime this week. So once the official Mount Sinai Health Forms is returned to you from the doctor's office, make sure everything is completed, signed, and stamped, and then you're gonna save the 2-page health form or any additional lab reports. You're gonna scan everything together as one PDF file and save it to your device. So to upload it, you're just gonna return to your Visas portal page to the health clearance instruction, scroll down, and make sure the attachment type is selected EHS non-employee clearance form. Locate your PDF document and click upload once. Please avoid trying to upload duplicate copies. That's just going to delay the process. So once you upload the health form, it will be in pending status, and then it will transfer the next business day. However, just keep in mind your portal will not update automatically to pending, rejected, or complete until we receive your approved medical clearance from EHS. This review process can take about 2 weeks after you submit it. Next part of your health clearance process is the toxicology test. Ashley provided a lot of information about this. You would have received an email from our office with the subject line, your drug screen Q passport. And that email looks like this. And in the body of the email, it has the link and all the information you need on how to schedule your appointment. And attached to the email is your Q passport. There's an expiration date on the top left. Please pay attention to it. I don't recommend it for last minute. If for whatever reason it has expired, please reach out to us so that we could notify you of the next steps. However, once you have this email, schedule your appointment and bring with you the Q passport. And for number 4 here, you could disregard, it doesn't apply to you. So again, for the health clearance process, it is the 2-page health form and your toxicology. Frequent asked questions about the medical clearance process. I submitted my health form, but notice the section is still marked as incomplete. So it could take up to 2 weeks Once a submitted health form is reviewed and approved by Employee Health Services, if you haven't received an update after 2 weeks of submitting your health form, please send us an email at volunteerdeb@mountsinai.org and we will follow up on your behalf requesting a status update. If anything is missing within your health form, Employee Health Services will reach out to you by email, and it's your responsibility to provide the missing information by uploading those documents to your Visa Support account so that it could securely be transferred to Employee Health Services for their review. How do I get a Q passport? The passport is sent to you by email from our office. It does expire, so make sure again to review that email and your Q passport. Do I need to submit the toxicology results to the volunteer department or EHS? So the toxicology results is free. Once you complete the drug test, you don't need to upload anything because those results will be sent to Employee Health Services directly for their review. And if you have any health related inquiries about the health clearance process, you are welcome to contact Employee Health Services at volunteerhealthforms@mountsinai.org. So that's their email address, volunteerhealthforms@mountsinai.org. So now we're going to go on to the next item, which is the corporate screening background check. For everyone, the resume should be stated as completed. If it's not, please let me know. For the corporate screening background check, we're going to click on the link for more instructions. And all the instructions will be listed once the page loads. And the first step is to click on the link in number 1 to create an account at their website. So if your browser is at max, you won't be able to enter the promotional code. So my suggestion is to minimize the browser a bit so you could enter the promotional code. This is, I guess it's corporate screening website glitch that they haven't fixed yet. So the promotional code is listed in number 2. So you're going to copy and paste the promotional code to the website and click continue. Then you're going to create your account. So everything here needs to be with your legal information as well as your legal first name and legal last name. If your legal first and last name is different from the full name in your visas application, please let us know so we could update it on your behalf. Once you're done completing your account, you're going to click register. Now, we do have a step-by-step guide on the next steps after that. So my suggestion is to click on the guide. It's in number 4. And where we left off is in page 2. So after register, that's when you're going to start the process. You're going to be consenting a few times some policy and terms from the website until you reach the part where you need to digitally sign your signature. And then you click I agree, and then the next page is to submit. So this is a final review with your personal information. It will also say this is going to cost $97 or $100. Please disregard the money amount. You will not be charged for the background screening. They will not ask you for payment information. It will be charged to Mount Sinai. So you're going to click submit, and then it should say thank you for providing the information necessary to conduct a background check. And to confirm that your background check is processing within your account at corporate screening, you could click on My Backgrounds in your dashboard, and it should be in this orange bar color saying that your background is in process. If it's in red, that means you did not submit your background check. You have to click continue and then follow all the steps prior to this to make sure that you submit your background check. And that's about it. So frequent asked questions for the background check. Is there a fee to complete the background screening? There is no fee to complete the background screening. How long does it take for the background screening to complete? It will take about 5 business days. It has taken longer if you live out of state just because the corporate screening website needs to comply with other state laws, so it might take longer. And if you have any issues submitting the background screening, contact us at volunteerdeb@mountsinai.org. So same with the health clearance. Your corporate screening background check requirement on your main checklist will not update automatically because we're waiting for the clearance from outside vendor. So once we have your approved clearance, then your portal will update. So as of now, once you submit your background check, it will stay as is until we have your clearance. Next is the reference check. So click on the link for references. And to pass the reference requirement, you need two references checked. Once you click on the link, or if you click on Manage My References, it will list all the references you listed on your application. And if it's pending, it will be in pending completion status, meaning that your reference hasn't completed the reference survey yet. They will receive a reference survey by email to complete online, and then it is submitted back to us for review. So to remind your reference to complete it, just open it up by clicking Edit, check off Resend Reference, and click Save. So your reference is going to receive a new email, I will say within 10 minutes, and you want to check in with your references to make sure they received it, that they checked their spam folder. If you want to cancel, it's the same way. You click on Edit, check off Cancel. And to add a new reference because you're like, okay, this person hasn't done it in 2 weeks and they're not responding to my messages. Click Add New, enter the information, and click Save. So that's about it for the references. You just need two references checked and we will review, and you could always manage it by adding, canceling, or resending. Next is the confidentiality statement. For the confidentiality statement, you're going to click here for instructions. You're going to click on the link at number 1 to download the statement. The statement is 2 pages. So you're going to read page 1 and page 2. And at the end of page 2, you're going to print your name, you're going to sign it, you're going to date it. And for employer, you have to write Mount Sinai. It will be rejected if you leave it blank. It will be rejected if you put anything else but Mount Sinai, like Delirium or Joseph Friedman or Emily. It will also be rejected if you only upload page 2. So make sure you scan page 1 and page 2 together and then upload it by returning to the confidentiality statement page and then click upload. And then it will be on pending status until it's reviewed. So we're going to go back home. Next is education modules, also known as visas trainings. There are 6 trainings to complete: fire and safety, code of conduct, HIPAA, emergency management, infection prevention, and sexual harassment. Each of these training, there's a quiz at the end. It's a question per page. At the end of the quiz, it will let you know if you passed or did not pass. If you did not pass, you just take the quiz again and again. If you did pass, you click done, you go back home, and it will automatically update to completed because these are real-time status updates that um because you're completing it straight from your Visas account. So this will definitely take more than an hour to complete. So please give yourself time after this info session, after work, after school, this weekend to complete as soon as possible. For HIPAA, I do want to point out because I do receive a lot of questions about this. So for HIPAA, it's a video. So you're going to click start, you're going to click OK, and a new tab will open. So you're going to click play, watch the video beginning to end. And for the quiz to start, you need to exit out from the tab, click done, and then the first question will appear. So a lot of the questions I was receiving is, where's the quiz? So I just showed you now in case you run with that ish. Same question. Next, this is just a screenshot of how the visas trainings, also known as education materials, look like when it's completed. So if you can see here, HIPAA, infection prevention are completed. So the next slide, oh, before the next slide, the last requirement here is international personnel clearance. I don't think anyone here has this requirement, but just for more information, the international personnel clearance only applies to non-US citizen and non-green card holder. If you're a non-US citizen An immigration specialist will reach out to you from the International Personnel Department requesting more information and documents to review so that they could send our office your clearance. If you are a U.S. citizen or green card holder, then no further action needs to be taken. And that's about it from your main new on-site hybrid volunteer checklist. The next slide that I'm going to show is information about your deadline. So deadline to submit and complete all the requirements from your main checklist is due January 10, 2025. So please make a note of it, put it on your calendar. It doesn't mean to leave everything for last minute and submit it the date of January 10. I mean, unless you are in communication with us and there are circumstances and you let us know of some delays. But January 10 is the deadline. And we hope that you're cleared either by January 10 or probably a few days after. The start of the Delirium program will be around the end of January, and you will receive more information from our program coordinator about ID, the program, as we get closer to the start date. If you complete the onboarding process early, like sometime in December or the first week of January, you're just gonna have to sit back and wait until you receive information about the next step. And that's it for the presentation. Again, I will provide a copy of the PowerPoint. I will provide the recorded video once I have it approved. And if you have any questions, please email us at volunteerdep@mountsinai.org. You could call us at the phone number on the screen. You could also drop into our Zoom office hours. There's no appointment needed. It's one-on-one assistance, Monday to Fridays. Monday, Wednesdays, and Fridays from 10 to 11. Tuesdays and Thursdays is from 2 to 3. Keep in mind that the week of Christmas, the office is closed the 25th and closed January 1st. And if you have any questions about the health clearance process, you can email Employee Health Services at volunteerhealthforms@mountsinai.org. I'm going to stop the recording.